As we prepare to spend more time outside in the great Idaho weather, it's also a great time to talk about protecting ourselves and our kiddos from skin cancer. I spoke to oncologist Dr. Gorden with Saint Alphonsus to learn more. Dr. Gorden, is so good to see you. The weather's warming up, a little more skin is showing when we head outside, so let's talk about our skin health. First of all, what is melanoma and what's its impact here in our region?
Yeah, so these are important questions. So melanoma is a skin cancer, and we think about it's the one that really matters. It arises from the deep layers of our skin and has the potential to really spread to any part of the body. When we think of how it impacts our community, we think about how often do we see it, and we recently learned that working with the Oregon Health and Sciences University, that we found it's in the top 5 cancers that we diagnose here in our region.
Wow, okay, so help us understand who is at greater risk of getting melanoma.
Yeah, so first question we want to think about is other family members or those close to us that have melanoma, because that might be a sign that it may not be genetic or inherited, but maybe there's common activities or lifestyles that's putting that person at risk. These tend to be people who have a fair complexion or they burn easy in the sun. And another group might be those who are immune compromised, whose immune systems, either by medications they're on or certain conditions, prevent their immune system from controlling cancers or identifying them.
Okay, can we actually prevent melanoma?
There's some things we can do to prevent kind of the injury from the sun and the UV damage. Some of those are avoiding that time of day when the sun is most intense, usually between 10 a.m. and 2 p.m. That might get extended a little bit longer in our warm summer months and being at a northern latitude. Other things could be putting on sunscreen, things with an SPF rating of at least 30, and being sure it gets time to set, at least 15 minutes when applying it, and putting it on again if you're out for more than 2 hours. Take in mind we have Boise River, a lot of water sports, so if you're getting wet or sweating a lot, you should probably put it on a little bit more often.
Yeah, that double application, very important. And if someone would like to be screened for melanoma, what do they do? Tell us about that process. Yeah,
so a lot of that is kind of being familiar with your body, knowing that you're at risk, and that's where we utilize the ABCDEs of skin cancer to help find things that should have a closer look by your provider or dermatologist. So the A would be asymmetry, B, border irregularities, C, color changes, D, diameter, something bigger than the end of a pencil eraser, or E, probably the most important thing is things that evolve or change over time that catch your eye, that should be looked at more closely.
And if someone is diagnosed with melanoma, how's it treated?
If we can prevent it from happening, that'd be best. Next thing we'd like to do is catch it early. So our best chance of curing it is if we can see it at its thinnest or earliest stages, and typically a dermatologist or surgeon can remove those.
Are there any advancements in melanoma treatment?
In those cases where melanoma is unfortunately spread to other parts of the body and surgery isn't the answer, we do have some medicines available. In the last 10 years we've had advances in immune therapy in which we can rely on the immune system to control melanoma for a long period of time. And for some melanomas we have some weaknesses we can take advantages where even pills can control that melanoma as well.
Okay, and then if people want to learn more, where do they go, Dr. Gorden?
Yeah, you can visit our website at saintalphonsus.org for more information.